Thank, thank you, Dana. So welcome to our webinar and thank you for taking the time out of your probably busy schedules to be with us today. Climate change, migration, and public health. A One Health approach to building resilience to emerging health threats in the Middle East is what we will be discussed today. It is the fourth in a series co-hosted by EMFNet and RTI. EMFNet is a public health non-profit organization established to support better health in the Eastern Mediterranean region and beyond, while RTI International is a global research institute and a leading international development organization focusing on the intersection of climate change and health threats. Both organizations bring together their multisectoral expertise in climate, biodiversity and conservation, agriculture, and global health security. They joined forces in July 2023 to provide this platform to the regional community to share lessons learned and experiences in applying the One Health approach towards improving the human condition. This webinar falls in December, coinciding with the International Day of Epidemic Preparedness. As such, highlighting the critical importance of addressing public health emergencies driven by climate change and underscores the need for preparedness to safeguard communities and build resilience. Before I introduce the topic in more detail, I would like to request our esteemed audience to use the Q&A feature for questions, the chat feature for comments. Unfortunately, audience mics will be muted throughout the webinar. Coming back to our topic, the interconnected challenges of climate change, migration, and public health threats are some of the most pressing issues of our time. According to the World Bank, estimates suggest that 250,000 additional deaths per year are caused by climate change, causing malnutrition, malaria, diarrhea, and heat stress between 2030 and 2050. The World Bank predicts internal climate migrants may total 216 million by 2050. This is particularly relevant for the EMR, the Eastern Mediterranean region, from malnutrition, malaria, diarrhea, and heat stress, and so on. Extreme climate events are not only displacing populations, but also exacerbating health risks, creating a cycle of instability that threatens communities across the region. So where is the gap? Existing research remains limited in the region. Thus, the gap of knowledge limits comprehensive understanding and data-driven strategies to address the intertwined impacts of climate change, displacement, and health risks effectively. National and subnational leadership in the region don't have the evidence they need in order to make informed decisions and identify effective solutions, and how we can maximize limited resources by leveraging multi-sectoral efforts. Dr. Hovell will speak to this more as she discusses the research we worked on together on climate change impacts and mobility in the Middle East. The One Health approach provides a powerful framework for addressing these challenges. It emphasizes the need for collaboration across disciplines and sectors, ensuring that we tackle these interconnected issues in a comprehensive and sustainable manner. Our goal today is to move the conversation forward by identifying where additional research and evidence is needed to support countries in developing resilient systems to health threats. In the coming weeks, we will share a report from the discussion we have today to help shape a robust research agenda, one that can highlight the gaps of knowledge to promote research and inform policies and interventions to build resilience and stability in this region. I am very happy to be part of this distinguished panel who bring together a wealth of expertise from different but interrelated fields: climate change, migration, public health, and urban planning. Each of our distinguished panelists offers unique insights into how these complex issues intersect, especially in the context of the Eastern Mediterranean region. By bringing together perspectives from social research, public health systems, migration dynamics, and urban planning, we'll explore together how the One Health approach can be a powerful tool in addressing the region's emerging health challenges. We will start our webinar today with Dr. Lucy Hovell, partner at Expectation State and Senior Research Associate, Refugee Law Initiative at the University of London. Welcome, Dr. Lucy, to this panel. And please go ahead with your presentation.
Thanks very much, Mohammed, and thank you to all of you for joining today. It's great to have so much interest in this really important subject. So, as Mohammed said, I'm just going to talk about some research that I did with Mohammed fairly recently in sort of earlier this year. That was really trying to explore some of the linkages between climate change impacts and migration or mobility. We use those two words fairly interchangeably in our report, in the Middle East, and it was focused primarily on the Middle East. So next slide, please. So I'm just going to quickly give you an overview of what we did in terms of the methodology. It was really, in essence, a literature review that was supported by a number of key informant interviews. So we looked for a material that was relevant to both the impacts of climate change, but also to migration in multiple different ways, and looked at about 155 different entries. And then we interviewed a number of key experts across the region and carried out a few focus group discussions just to really build our understanding and look both thematically and geographically at the different areas, and particularly at the gaps in this area. So next slide. I'm going to just talk first of all about a sort of overview of climate change impacts, but I'm not going to dwell on this very long because I think we know this very, very well. But suffice to say, there are a number of factors that have an impact on the movement of people, whether it's water resources, levels of heat stress as a result of extreme temperatures, which then in turn impacts where people can live, how they access livelihoods, the different demands on infrastructure, and many of the other dynamics that I think we're probably all very, very aware of. So next slide, please. So given this context that we're talking about today, a really important question is how, if at all, are different countries responding to these challenges, and how prepared are they for what is predicted to be significant climatic changes? And I think it's worth saying that globally, states have generally privileged climate change mitigation over adaptation. And from our work, the evidence certainly suggests that this appears to be the case in the Middle East, where countries are downscaling climate scenarios and climate information. And so obviously this is a region where there are a number of specific challenges that include governance structures that, for instance, exclude communities from decision-making powers around adaptation. There are a number of protracted conflicts in the region and instability. Obviously, we think about Syria, where there has been significant changes in the past few weeks, but we don't know where that's going to go. The situation in Yemen continues to be very unstable, and also in Iraq and other places. And then sitting alongside this are regional inequalities. And these all have a major impact on this interaction between the impact of climate change and migration. So next slide, please. So what do we mean and what are we talking about? I think it's important to emphasize that people have always moved. Migration has been part of human beings ever since we existed. And I think it's really important not to see it as something that's atypical. But I think what's true to say is that there has been a significant increase in forced migration in the last few years. And so the pie chart on the right shows the number of people who are refugees in different countries in the Middle East. And obviously those numbers are strikingly high. And on the left-hand side, at the same time, you'll see the number of people who are internally displaced. And so I think that brings us to the point that actually most people stay in their countries, or certainly at least in their region of origin. And this is really important. So next slide, please. So building on the Mixed Migration Centre has developed a bit of a conceptual framework for thinking about climate-induced migration. And this is the sort of model that's been developed. And so on the one hand, you have climate-related environmental stresses, and then at the same time, you have the extent to which people have existing adaptation strategies. So it might be a mixture of different strategies that might be of relevance. And this really leads either to people's aspiration to migrate, and then the other factor being their capability to migrate. And in a sense, this leads to four very tidy outcomes, of course, of which they don't really take that much bearing on reality. We understand that there's a lot of interaction between these different categories, but it tries to break down migration in relation to climate change. So some people are forced, if you like, to stay where they are. Others are forced to move from where they are. Some choose to move and some choose to stay. And of course, as I said, life is never quite that tidy or straightforward in terms of where people fit within those different categories, but it's just a helpful way of us thinking about some of these dynamics. So let's just break those down each in turn before I close. So next slide, please. So as I've said, there are significant numbers of people who've been forced out of their homes, called forced migrants, whether they're refugees or internally displaced persons across the region. So the statistics that we came up with, but have probably shifted since then, 11 million registered refugees in the Middle East and 12 million IDPs. Conflict is obviously a dominant factor in the fact that people have moved. But then the role of climate and environmental factors intersect with these things, both as a driver of movement, but also as a really important factor in displacement. And sitting across all of this are issues of governance, which are incredibly important, both to manage whether people might or might not become displaced, or also how you cope with those displaced populations. So a couple of statistics: in Iran, 42,000 people were forced to migrate in 2022, according to some estimates. And this was directly due to the effects of climate change. And in Iraq, IOM estimates that nearly 62,000 families live in locations where climate-induced displacement is taking place. And that 1 in 4 households are living in locations where at least 10% of the original population has already left. And so these are very high numbers, and it's very hard to tease apart the factors that leave someone, force someone out of their home in terms of the relationship between conflict and other factors, including climate, but there's clearly an intersection between them. So next slide, please. Of course, there are people who choose to move, and there's a lot of movement, rural to urban. This is not new, but it's definitely increasing. There's significant pull for labour opportunities in the Gulf Cooperation countries, and then movement outside of the GCCs in summer, which is particularly the domain of the wealthy, to escape some of the heat and other impacts. And then there's also irregular migration out of the region. This tends to dominate the headlines, and to a certain extent, a lot of the policy decisions made, particularly in Europe, but the numbers are incredibly small relative to other movement. And then there's the impact of climatic and environmental factors on migrant workers who are working in some of these countries. for instance, many migrants live in informal settlements that lack infrastructure. They're not then able to cope with some of the high temperatures, or they might be in areas that are really prone to flooding or other environmental challenges. One of the studies that Mohammed and I documented was from communities in Nepal where returning migrants have been suffering from chronic kidney disease because they had been working in extreme heat. So people who had been sent to work in the Middle East because they were very fit and able came back with these terrible health implications. So next slide. I think it's really helpful to remember that some people are, in a sense, forced to stay where they are. And I know that sounds a little odd, but I think this is something we don't think about very much. It's impossible to quantify this. We don't know, we can't count those who don't move, if you like. But for many people, they've depleted their resources. They have very limited choices. And actually, they're trapped where they are, if you like. And I think it sort of extending this, one of the things that we really found was there are people who are in what's called protracted displacement. So they've been forced out of their homes, but there's been no solution to their displacement. And they've now been living in displacement for many, many years. And they're then trapped there because their resources are continually being depleted and they can't move on. Syrian refugees in both Jordan and Lebanon would be one example of this. And likewise, we have a lot of IDPs, both in Yemen and Iraq, for instance, where they're living in very environmentally and climatically insecure areas, but they don't have enough resources to move somewhere that might be more conducive, for instance, to accessing livelihoods. And so on to the next slide, please. There are those who choose to stay where they are. And I think what became very clear from our research is people don't want to leave their homes or their way of life or their communities. If they're given the opportunity, they want to be able to stay where they are. And so this points to the key area of resilience about needing to allow people to choose to stay where they are. So just to conclude now, a number of overlapping factors. The categories are constantly shifting between these four, and there are obviously a quagmire of factors that lead someone to move or stay, but climate intersects with other factors to influence mobility. So just the last slide, very, very quickly. There's a very clear relationship that we found between human migration and the impacts of climate change. This is kind of obvious, but I think it's important to stress it. But of course, the degree of impact varies according to the intensity of climatic variability and extremes, and a whole bunch of different factors. As I said, people in the Middle East that we spoke to prefer to stay within their homes and communities if they have the choice. And most stay within their country or certainly region of origin. Then fifth, the fact that climate adaptation doesn't appear to score high on government priority lists, even in prosperous countries that have the resources to act, is a very major factor, and inequalities in the region are very stark, both between countries, but also within countries. I'm going to stop there and hand back to the chair, but really look forward to engaging on this. Thank you. You're on mute, Mohammed.
Thank you, Dr. Lucy, for a very informative presentation. I would like to remind our esteemed participants that there's a small Q&A box. If you have any questions for Dr. Lucy or any other speaker, please feel free to use that little box. And I'm really enjoying all the comments I'm seeing in the chat box. We've got people from all over the region and beyond, which is really great. At this point, I would like to invite Dr. Hannah to present and also enrich us with a lot of information that I think all of us will find very useful. Please go ahead.
Thank you so much for the great introduction, and thank you so much, Dr. Lucy, for your very comprehensive coverage of that important topic that relates very closely to the one I'll be covering. So I'm just going to be today discussing not just climate change and migration, but also the health impacts and how that specifically applies to populations across the Eastern Mediterranean region. Next slide, please. So why should we explore this nexus? This is an important question that many ask. Why is it relevant to look at this three-way intersection? Well, what we do know is that climate change and migration are very closely linked to each other, and Dr. Lucy's presentation has just elucidated how that is the case. We also know that climate change and health are very interconnected, as in there's many health impacts of climate change, and those familiar with this field and the recent research will have quite an understanding of the breadth of implications that climate change has on health. And we also know that migration impacts health because really when migrants are on the move, they're put in a lot of situations that are simply not conducive to health and well-being. And so we see adverse health outcomes across migrant, refugee, and displaced populations globally. So if we know that each of these dyads are connected, climate change and migration, climate change and health, and migration and health, what happens when we move beyond the dyads and look at them, look at the three phenomena interacting all together? So that's kind of the question that this research seeks to answer. Next slide, please. So there has been some early research on this three-way intersection, and enough research has been done to enable the emergence of some conceptual models describing these interactions. Presented on this slide, I have one of the ones that I feel is personally the most comprehensive in kind of displaying the various different linkages between these. For the sake of time, I won't be able to get into this in detail, but I will be discussing some examples in this coming slides. But as you can see here, you see that there are two-way interactions between each of the three factors, but you also see that a lot of the health and migration impacts of climate change are mediated through food and water insecurity. And this relates very closely to what Dr. Lucy was describing. But really, I think the important takeaway from this conceptual model, moving beyond all the detail here, is that climate change really at the end of the day acts as a risk multiplier of poor migrant health. And what we mean by that is that it essentially amplifies other determinants of poor migrant health in terms of having an exacerbative effect on the vulnerabilities that migrants already face from a health standpoint. And this will become clearer if it's not already through some of the examples I hope to review with you on the next slide. So you can proceed, please. Thank you. So now looking at some evidence from the Eastern Mediterranean region, there has been a relatively limited amount of research, as Mr. Mohammed explained at the beginning, and as I will also explain further in my presentation, but from the early research that has been done on this region, we see that the health impacts of climate-related displacement and migration are both direct and indirect. And when I say indirect, I mean they are mediated through social determinants of health. So migration impacts those social determinants that are in turn upstream drivers of poor health outcomes, or in some cases, positive health outcomes, which is another dimension I will explore. Looking though first at the direct impacts, we see vector-borne diseases are a huge issue among individuals moving in the context of climate change. For example, as we see pastoral and herder populations expanding their regions of mobility and migration, we're seeing that they are coming in increasing contact with certain disease vectors in addition to their livestock, and this relates to the One Health lens of animal health as well, it being intertwined with human health. We're also seeing waterborne disease spread. Of course, this has been rife in refugee and displacement settings globally for years. We're well aware of those impacts. We see gender-based violence and sexually transmitted disease spread. Many migrants often end up living in temporary housing and overcrowded camps, which are often poorly lit, lack running waters, and they also lack safe female-only sanitation facilities. We also see that women and girls often have to leave camps to access water and firewood, and this increases their risk of sexual violence and harassment. Heat-related morbidity and mortality is a huge one. As again, Dr. Lucy rightly discussed, a lot of migrant workers are at disproportionate risk of experiencing heat health impacts, such as, and these include chronic diseases like liver problems, skin cancer, and diabetes. Psychosocial trauma and poor mental health. This is a huge issue among displaced populations, as there's often trauma due to forced displacement. This has been seen particularly in the context of climate change, and especially for populations for whom their connection to the land has been severed, and this is particularly pertinent for Indigenous and Indigenous populations and those for whom connection to the land is a big part of their identity. And physical hazard exposure, of course, we see people moving in the context of environmental change, and we've even seen that they face disproportionate physical hazards en route. But something that's interesting is that we've also had some early research showing that most displaced persons are actually located in climate change hotspots as well. And then from an indirect standpoint, we see that there are impacts on social determinants of health, namely poor healthcare service access. This is an issue amongst migrant populations globally. Lack of access to food, water, sanitation, shelter, again, fundamental determinants of health. We're seeing, for example, a lot of migrants moving from the Horn of Africa across the Red Sea to Yemen and to the Gulf countries. This has been exacerbated by the impacts of El Nino and drought in that region, and the hazards that they face en route are multifold. And there's much research too that has shown that recently. Even altered household gender dynamics. Interestingly, we're seeing research now that majority of migration is male dominated, especially labor migration. And as such, this shifts household gender dynamics in a way that sometimes puts disproportionate burden on women to bear the responsibilities of childcare and household duties. And in addition to this, there's some studies showing that this puts females and women at increasing risk of sexual and gender-based violence as well. Loss of social cohesion, intercommunal violence and conflict. Again, farmer-herder conflicts have been rife in many locations affected by drought as herders have to expand their ranges of migration to access fertile grazing areas. And finally, I just want to emphasize that not all of this is negative. As much as the research overly highlights the negative impacts, there is some potential for positive impacts from climate migration when it is done in a way that facilitates resilience building and adaptation. So we've seen some research on this already. For example, research in Algeria, Egypt, Morocco, Syria, and Yemen has shown that remittances have had positive impacts on poverty indicators, school enrollment, and measures of malnutrition. And so I think this is another dimension that I would love to explore further, but for the sake of time, I will just mention briefly is something that we also need to focus further on in this research. So next slide, please. So just, summarizing some of the research gaps, we do see that there, as mentioned, are some geographic gaps specific to this area. A systematic review of climate-induced migration in Africa actually found that only one study was exclusively focused on North Africa. The majority were focused on sub-Saharan Africa. We also have seen just limited data generally on migration patterns from Middle East and North African regions, specifically in relation to climate change. And of course, thematically, we see some major gaps in terms of lack of focus on mental health, heat hazards, people living with disabilities and chronic health issues, gendered impacts, and again, protective factors. What are some of the factors that allow individuals to be more resilient in the face of climate change when moving and when migrating? And methodologically, it's unfortunate, but there is still quite a lack of rigorous empirically based research. We do have a lot of theoretical projections that are not backed by empirical evidence. And it is, of course, because of the complexity of this research, very difficult to obtain longitudinal data, so data that's essentially represents long-term health impacts, and that's taken through long-term observation of these populations. And it's also very difficult for us to directly attribute some of these impacts to climate change because of the multiple different factors at play and the possibility of different confounding influences. And now just moving on to the last slide, please. I would just like to very briefly highlight some policy and practice priorities. I'd like to emphasize this is not an exhaustive list, but it's important that moving beyond the research in this space, we start to think about things such as bridging silos at the systems level. Really, at the end of the day, migration, environment, and health they've historically been separate divisions, governed separately, and really represent different areas of technical expertise. And we need to bridge these sectors and create interdisciplinary collaborations if we are to adopt joint solutions. The WHO framework for climate resilience, for example, provides some important programmatic direction for strengthening health systems and specifically ensuring that they are migrant inclusive. This next point touches a lot on what Dr. Lucy has shared, which is facilitating migrant agency and choice. In a lot of cases, migrants do not want to move. It's not their first choice. It's rather a last resort option. In other cases, they may feel that this is the most adaptive resilience building option for them in the context of climate change as a result of other adaptation options having been exhausted. And so we need to undertake a systematic mapping at the local level of what individuals want, and how we can create programs that support them in being able to move with agency or stay in place if that's their choice through in situ adaptation measures. And finally, just building general climate and health resilience among individuals displaced. We already know that there are massive numbers of displaced individuals, whether it be due to climate change or other factors. We need to ensure that these populations generally are resilient to the impacts of climate change, as those are going to impact them regardless of their reasons for displacement. We can see some interesting innovative measures used in this regard, such as in Lebanon and Jordan, where they're using international climate finance to increase the resilience of people displaced even by crises. For example, using funding from the UN Adaptation Fund to address water shortages in urban host settlements. And we've seen some other innovative programs being launched in this space as well that can provide exemplars for working at this intersection. So thank you so much. I will leave it there, and I look forward to discussing further in the question and answer period.
Thanks a lot, Dr. Hannah. I'm sure we'll come back to you with a few questions later, but now let's move on to a colleague who I had the pleasure of working with through UN Habitat, Reem Halase, who is a climate, environment, energy, and DRR specialist. The floor is yours.
Thank you, Mohammed, and the pleasure is all mine, definitely. Let me start with my presentation. I hope you can see my slides. Yeah?
Yes, we can see it very well, please.
Okay. Perfect. So thank you, Mohammed, and thank you everyone for joining us. I'll be speaking about the case of Amman, vulnerability assessment for Amman city in Jordan. For who don't know Amman, it's the capital city of Jordan, next to Palestine and Lebanon and Syria, definitely, and the whole conflict countries. So Amman is the capital. It's the most urbanized city in Jordan, with 97.2% of the population lives in urban settings. The city area is around 800 square kilometers. The population is around 4,600,000. And the population density is very high, 612.5 persons per square kilometers. Number of refugees in 2020 was 193K, and it's, as I mentioned, it's the most urbanized city in Jordan, and it has 22 districts and 203 neighborhoods. So Amman city, what are the challenges linked to climate change? The high urbanization, as I mentioned, the rapid population growth, the urban enrichment on agricultural land, the influx of refugees, the weak public transportation and pedestrian networks, the unemployment rate, which reached 24% in Amman. The high energy cost, the imbalanced supply and demand of water resources, and the water scarcity that we've witnessed and we already struggle in, lack of open and green public spaces, the depletion of natural resources, especially water resources and natural heritage, pressure on infrastructure, pollution, inefficient land use, social inequalities, and increased municipal solid waste, and the general imbalanced production and consumption patterns in the city of Amman. What's the environmental context? I'm mentioning all of these because we're going to link it to the vulnerability assessment and to the health systems in Jordan. So the air quality, we have good air quality in Amman. The water quality is also good, with over 99% of drinking water quality meeting national standards. Municipal solid waste management, general decline in waste generation within Amman city. 97% of population has regular access to waste services, which also contribute to the health and hygiene and sanitation context of Amman. Open green spaces, unfortunately, we have 1.768% of Amman city area is dedicated to green spaces, which is quite low, whereas 3.18 square meters is the per capita share. Water and waste management, wastewater management spans across the entire city, while we have 76% of the network covers 76% of the city. The stormwater management, we don't have comprehensive master plan for the stormwater network in Jordan or in Amman specifically, and we have like aging infrastructure related to stormwater management. What is climate change doing to Amman? The climate alteration in Amman city, we've witnessed actually during the past decade, a warmer climate. We have the mean temperatures and heat waves, precipitation and drought. And what we're gonna witness more and more, according to the climate projections from the Fourth National Communication Report on Climate Change, we're gonna witness more warmer climate, a drier climate, more intense heat waves, more drought and contrasted water balance, intense precipitation and potential floods, mild decrease in relative humidity. And all these climate hazards will impact also our health and the whole ecosystem, the whole biodiversity. So going a little bit back, talking about the past climate related hazards events, we've witnessed and we're still witnessing more intense heat waves, more frequent heat waves. We're also witnessing flash floods, especially in the central area of Amman, which is the downtown, and now it's going further to other districts, to the western districts of Amman, and drought, as I mentioned also, and what's more important here, the vector-borne diseases, airborne diseases, and waterborne diseases. Leishmaniasis is one of the significant vector-borne diseases that we're witnessing in Amman. Airborne diseases, we have definitely the respiratory and airborne diseases, COPD, lower respiratory infections, asthma, allergic diseases, and you mentioned it. So waterborne diseases, also diarrheal diseases and typhoid. And we have like good evidence about the cases of diarrheal diseases in Amman in the past decade or 2 decades. Insect infestation is also crucial when we talk about One Health approach the bark beetles, ground beetles, and termite infestation is also present in Amman. Climate change impact on Amman city, as I mentioned, heat waves, drought, flash floods, and borne diseases. However, we're not witnessing that much of cases of borne diseases. However, it's emerging, and definitely we're going to witness more and more evidence, more and more cases of borne diseases in the next few years and more. So climate change impact on the city, what's the specific impact? We have definitely its impact on city systems and infrastructure, on people, definitely, and especially vulnerable groups, people with disabilities, refugees and migrants, indeed, and poverty and social inequalities, the impact on education, on the biodiversity, the natural resources, and indeed the health sector and the health system in the city. And the economic activities, definitely. So when we look at the IPCC report AR6, the latest one, we can see the risk is connected with the vulnerability, hazard, and exposure, where we have the heat, drought, floods, and vector spread, the exposure, the outdoor employment, and this we're gonna see it in the vulnerability assessment later on, and how vulnerable groups are most impacted by climate impacts or by climate hazards. So the impact, how the systems are impacted also by climate hazards. So this is one of the studies that I worked on with UNDP, UN Habitat, and it was funded by UNEP for Greater Amman Municipality, assessing the climate vulnerabilities in Amman city. So we've also, in addition to heat waves, flash floods, and drought, we've also studied the vulnerability assessment to vector-borne diseases. So when we mention when we talk about vulnerability, we talk about sensitivity, exposure, and adaptive capacity. So the exposure, people, how people are impacted, the demographic perspective, population density, refugees, population, number of households, the assets, the residential areas, commercial and industrial, and we have the female populations who are more vulnerable to climate hazards or to vector-borne diseases, people with disabilities or precisely with disabilities, youth, elderly, city workers, definitely, and the infrastructure and how the city is coping with these changes and these exposures. So the health, we have a very comprehensive complaint system in Greater Amman Municipality to check the health situation in Amman, especially when it comes to insects, rodents, and black spots specifically. Adaptive capacity, definitely green spaces, sewage network subscribers and coverage, services like waste collected, waste dumpers, and definitely the health system, how it's also adapting to climate. As we can see, some districts are highly impacted or severely impacted by vector-borne diseases. And this is the case right now. For example, Basman and Yarmouk and others. And as we also mentioned about vector-borne diseases, we've mentioned about waterborne diseases and how the system is coping with the exposure, sensitivity, and adaptive capacity. I'm not gonna go through it because we don't have time, but this is for your info. And as we can see also the vulnerability assessment to waterborne diseases in the city is more intense and more severe in case of the eastern part and the southern part of the city. Also airborne diseases, and as I mentioned before, the air pollution, the transportation, and anything related to the human activity that exacerbate the air quality in the city. So vulnerability assessment to airborne diseases as well, and which districts specifically are more vulnerable to airborne diseases. That's it from my side.
Thank you so much, Shreem, for this
Thank you, Mohammed.
very useful presentation. And I think more and more of this work will be required in the future as the impacts of climate change increase. Before we jump into our Q&A session, we have a question to share with our esteemed participants. So which of the following climate change related topics are you most interested in? And this will help us in determining our future webinars: climate change and emerging infection diseases, health risks of extreme weather events, food and water security under climate stress, air pollution and public health in the climate crisis, and the role of policies and governance in climate adaptation. We'll give a minute for everyone to vote. Okay, let's check the results, please. Excellent. So number one was climate change and emerging infectious diseases. Very interesting. Then I think the next four received equal interest. The total number of votes was 143. We will have another poll at the end, so I encourage more people maybe to take part. Now, let's proceed with our Q&A session, and we'll start with you, Dr. Lucy. Migration in the Eastern Mediterranean region is increasingly driven by climate change. And I think this is a fact that we've already established. Can you speak to how climate-induced displacement has evolved in the region, and what are some of the implications for both migrants and host communities?
Thanks, Mohammed. And I think, in a way, we've started to touch on this quite well with the different presentations. And I think, first of all, to say the obvious, as I said, it is sometimes really hard to tease apart the different factors that lead people to move, whether it's voluntarily or not, or a mixture of those two things. And I think it's just remembering those kind of undergirding structural or systemic factors that are the environment in which people do move, so around sort of the broader conflicts and issues around governance. And these still have a bearing, even though they might not be necessarily the primary driver. So climatic factors can often be an additional factor. I think Hannah talked to them about it as a risk multiplier, and I think that's a really, really good way of looking at it. I think a really big factor is around this issue of urbanization, and Reem brought this alive so brilliantly, looking at Amman. And I think just getting that understanding, there are so many complex issues involved in urbanization, but where someone who's coming from outside, you don't necessarily have the resources. You're maybe living more on the peripheries. You might or might not have the right documentation if you're a refugee or asylum seeker. You might be considered somehow not allowed to be there if there's an encampment policy in the country, or for various other reasons. There are a lot of things that, if you like, keep you very much on the margins. And I think that's a really, really big factor. So thinking about that kind of, if you like, social cohesion category that Hannah referred to, I think is really, really important, because this is the context in which these different health factors emerge and are really, really relevant. So I just, yeah, I'll stop at that point, but I think there are enormous implications. Maybe just sorry to come to the second part of your question. I think it's really important to remember not just the people, if you like, who have moved, but the people who are, if you like, hosting. And we talk about host communities as if they're a sort of homogenous group, but actually it's individual families, communities, localities absorb people coming in from other areas, and that often has a really, really big impact on the pressure on different resources, on infrastructure, and all these different factors. So I think that's all relevant. So thank you. I'll stop there.
Thanks a lot. I'll move on to you, Dr. Hannah, and I'd like to ask you if climate migrants should be considered a separate migrant category with unique health needs, or are conventional practices towards promoting migrant and refugee health enough to address the needs of individuals moving in the context of climate change? Sorry for the complicated question.
No, thank you so much for that. I think this is really the million-dollar question we need to ask when it comes to moving forward with approaches and development of strategies on addressing this three-way nexus that I reviewed in my presentation. Is this more business as usual, or do we need to fundamentally change the way we approach migrant health, is the question. And I think that the answer is complicated. I wish I could have a simple one, but I think that really the answer is that there needs to be a bit of both. There needs to be some scaling of business as usual and some fundamental development of novel approaches to addressing the unique health needs of these populations. And to elaborate on that, I think that, for one, we know that the sheer numbers of people on the move, migrating, undergoing, facing internal or cross-border displacement, will rise in the coming years as a result of climate change, whether climate change is the direct driver or it interacts with other factors that further amplify trends of mobility. We know that the numbers of people are going to increase. And so we do need to scale our approaches. We need to scale proven approaches towards addressing migrant health needs as a result of the fact that there will merely be more people that need such support. But beyond this, we're seeing some interesting research that is suggesting that climate migrants may have some unique vulnerabilities. That's not to suggest that they should be treated as in different migrant category when it comes to broader health programming, but rather that some of their unique vulnerabilities might need to be attended to and focused on within this programming. For example, we might see certain vulnerable subpopulations or regions, such as pastoralists, individuals with resource-based livelihoods, coastal regions, indigenous populations that are based in small island developing states. We may see that there is increased migration in these regions and increased vulnerability of migrants in these regions as a result of climate change. A direct example is this concept of solastalgia, which is really an academic term that's being used increasingly to describe the mental health impact of feeling disconnected from one's land and from one's having a disconnection from nature. And this is particularly pertinent for indigenous populations and those that, for example, may have inhabited small island developing states for millennia, and then may have to be uprooted and leave their traditional lifestyles. So these types of mental health impacts are fundamentally unique to climate change. We also may need to focus more on internal displacement. As Dr. Lucy rightly said, a lot of the displacement that's going to happen is not necessarily going to be cross-border, but rather occur within country boundaries. And of course, in relation to the discussions we've already had as well, certain climate-sensitive diseases might become more pertinent within refugee and migrant populations, like vector-borne diseases, waterborne diseases, heat-related morbidity, and other related diseases. So all of these things in summary will lead us to need to focus more on certain populations, certain diseases, but that's not to suggest that conventional proven migrant health strategies are not going to be still effective in addressing the health needs of these populations. And we need to focus on scaling those solutions that we have seen work and are proven to be effective.
Thanks a lot. Makes a lot of sense. Moving back to you, Reem, and I have a question, which is, your work on climate vulnerability in urban areas highlights the changing dynamics of cities in the region like Amman. How do climate-induced migration and urbanization intersect? And what are the unique challenges cities face in building climate resilient health systems?
Thank you, Mohammed. Yeah, climate-induced migration and urbanization intersect in cities like Amman, where rural populations increasingly impacted by climate change are migrating to urban centers for better livelihoods and living conditions. Climate change affects culture and livelihood in rural areas, leading to the displacement of people seeking economic stability in cities. This migration adds pressure to urban systems, increasing demand for services, infrastructure, and houses, which may already be strained by rapid urbanization. In cities like Amman, building climate resilient health systems faces several unique challenges, sorry. First, there's been a lack of public awareness and understanding of the link between climate change and health, which results in insufficient integration of these issues into urban policies. Over the uncertainty of climate impacts, along with the emerging challenges such as extreme weather events and environmental degradation, further complicates efforts to strengthen urban health systems. And my last point is the rapid urbanization associated with climate-induced migration also leads to overcrowding, inadequate housing, and poor access to sanitation, which undermine public health as well. In addition, socioeconomic disparities, low literacy rates, and drain on public spaces make it harder to ensure equitable access to healthcare and services. The case of Amman, which has hosted a large number of refugees over the past 3 decades, exemplifies how migration can bring new health challenges, that it often requires cities to adjust to both immediate needs of displaced populations and also long-term climatization strategies and measures.
Thanks a lot, Reem. And what I'm hearing from everyone is that the complexity of the matter makes it a little bit more difficult to tackle, especially since there are different factors involved. Whatever impacts something is a cause to another, and finding ways through which these all are linked is not an easy task. And this is why, as we said initially, we need much more research. Before opening the floor or starting to answer the questions we received from the audience, may I ask the hosts to share with us our last question to the participants for today. And the question is, what specific topics or areas would you like us to dive deeper into in our next webinars? We'll give this a little bit more time so that we get more answers, please. Okay, so let's see the results. Okay, 100% have answered, but I assume this will not be visible from my end, so we will move on to the final section of this webinar, and I'll going back to you, Dr. Lucy, and I would like to ask you it's not me actually, it's one of our participants, and we appreciate all the questions that you've all been asking. What are the key policy interventions needed to address climate change impact on migrants?
Great. This is a very good question. Thank you very much for it. And it's also an impossible question because there isn't an easy answer. But let me just give a few thoughts. I think to begin with, just thinking sort of, if you like, going back to basics, at the most general level, it needs to be policy interventions that give people agency and give people choice to the extent possible. We've talked a lot about people needing to be able to choose not to move. And I think someone put a comment in the chat about why don't we also look at the rural areas? We focus on urban areas. And I think that's a really good point. There's a real danger that because of large-scale urbanization, that rural areas get neglected and then we get more urbanization. So that's one really good example of the two things needing to kind of interact with each other. So I guess that the first answer to the question is we need multiple policy approaches, because the thing about climate change is it needs to come from so many different directions at once. But I think also thinking about those who have been forced to move, there is a very well developed policy structure around both refugees and to a certain extent IDPs. And I think that one of the, while not everyone fits within this category, if you like, and it's still being much debated as to where people forced out of their homes as a result of climatic factors fit in terms of policy structures. And that's going to be debated, I think, for quite a long time from now. I think one of the things that's really worth thinking about is the sort of durable solutions framework for refugees and IDPs, for people who are displaced. How do we have policies that better resolve that displacement? And I think that's a really, really big factor. I think to the extent that there's been such a neglect of this issue has left a lot of people in protracted displacement for a very long period of time, which then has a massive knock-on effect, not only on their own lives, but also on the lives of, as I said, some of the host communities where they're living. So I guess there are a lot of different policy interventions that are needed, but thinking specifically about forced migration, I think we should be thinking about how we draw upon some of that policy structure that exists already and making sure we can apply it really well in this context. Thank you, Mohammed.
Thanks a lot. And I have another question for Dr. Hannah, which is how can we ensure the quality and reliability of data provided by governments on migrants, considering the various push and pull factors driving migration?
Yeah, thank you so much for this question. Yeah, no, it's a really important answer and one that, again, like most of the questions is difficult to offer a simple response to. But yeah, some of my thoughts on this matter are that really I think there needs to be more collaboration, and I emphasized this already. I know it's kind of an over-touted strategy, but really at the end of the day, the migration that we're seeing, as much as it's going to be internal, it's also going to be cross-border. We're going to see both, and we need to facilitate data sharing. I think this is really important to not have isolated data systems, as in we know we really need governments to be able to share and collaborate in the dissemination of migrant health data across the region. That said, in response to your question about, you know, the difficulty differentiating different push and pull factors, I personally feel that, I mean, depending on what the objective of the data is, or what the intended use of the data is, the answer to this will differ. But bringing the health perspective, given my background, I personally don't think the reason for the migration is really the important question to be asking when it comes to looking at vulnerabilities and health needs. Whether they've been migrating because of climate change, because of conflict, because of some interaction of the two, or because of some other complexity of factors, socioeconomic or otherwise. At the end of the day, where our question needs to be what are their health needs, and what are the gaps that we need to fill in being able to meet those health needs. And again, I think sharing migrant health data across borders is essential, and being able to also facilitate collaborations between governments and civil society that are already tracking some of these impacts, but may not necessarily be sharing them openly with governments to support and facilitate their response to such information. So these are some strategies I can think of, but again, very, very difficult question to answer, and a lot more needs to be done in this space. Certainly, I'll just leave it at that though for now.
All the questions are difficult today.
They
That's the
really
main
are.
idea, is because
Yes.
these questions exist. This is why we are holding this dialogue today. So coming back to you, Reem, we have two questions from our participants. One is, how does Jordan define heat waves in terms of duration and temperature thresholds? And then, how were the levels of different vulnerabilities in Amman city assessed?
Okay. So the first question, heat wave, it's a global actually threshold. It's 5 continuous or consecutive days with maximum temperature at least 5 degrees Celsius higher than climatological of same calendar day. So for example, if we have 40, it's like 5 days continuous, 5 days of over 40. As we witnessed in Amman this year, it was 46 and it was continuous. So we consider that a heat wave. So the second question, actually, it's a long process. It's based on the C4T guideline on climate change vulnerability and risk assessment. It was an evidence-based and scientific-based. The methodology was very intense, and it was very comprehensive. We developed indicators from scratch. We collected data from Greater Amman Municipality and other stakeholders to get the information to analyze also the information that we had, and also the climate projections from the Fourth National Communication Report. If you need any other questions or you need further clarification, you can also check the report, or you can check the article assessing climate vulnerabilities in Amman City.
Is there a link to the report we could share with the audience?
Unfortunately, not yet, but
Okay.
it's going to be published soon, very soon.
Very good. So since some of the audience were unable to answer the previous question, may I ask the hosts to pose the question again? So more people are answering, and we'll give it more time this time, because your input is extremely valuable and we appreciate it. So please, any of our esteemed participants who has a comment or an answer, please go ahead. It seems that no, people are still answering. So we'll give it just another 30 seconds, please, or even a minute. I hope there's another answer. Good. There's a high level of engagement. This is really excellent. I still think that 3 minutes were sufficient. At 3.5 minutes, please, let's end this poll. Or while we have another few questions from the audience, not addressed to specific speakers, and I'll start reading them, and I'll leave it to our distinguished panelists to decide who would answer. So mental health was mentioned by multiple questions. One of them, which is, given that mental health is often overlooked in such crisis, how can we bring more attention to this issue, and what steps can be taken to address it effectively? And I think, Dr. Hannah, you touched upon this in a way. I don't know if there's anything else you'd like to mention to elaborate. Or if anybody else would like to jump in.
Yes, thank you for this. Sorry, I'll just have briefly that really I think that I agree. A lot more needs to be done on this, and a lot more research needs to be done on what the term that I put forward previously, which is it's referred to as solastalgia, and it's really something that we're seeing in relation to this disconnection from traditional lands and livelihoods and natural resources. And this is something that we as a global health community, I think, are very new to, and we don't know a lot about. And I think there needs to be, first and foremost, a lot more research on how this plays out, how this manifests in different communities before we develop concrete approaches and evidence-based strategies to provide psychosocial support to such populations. But in relation to mental health more broadly, I think it's just something I wanted to note is I've been involved in some research recently on climate-related health impacts of climate-related displacement and migration. And interestingly, we did find that there was a fair amount of research on mental health impacts of climate-related displacement and migration, but where we found the gap lies is in program and policy approaches. Again, there's a very heavy tendency to focus on these kind of, hot and sexy diseases, so to speak, like vector-borne diseases and climate-sensitive diseases and infectious diseases, and those that get a lot of donor attention and funding. And in mental health is very overlooked, maybe not as much in the research end of things, but more so in the programmatic and policy response end of things. And so I think really, again, moving beyond this kind of very simplistic understanding of health, we need to look at health as being a broader construct that moves beyond just the mere absence of disease, as the WHO says, and that really starts with understanding health and well-being in a more holistic manner. So I'll just leave it at that.
No, excellent. And I'd like to mention here, last year I spoke at a conference in Vancouver on addressing the climate crisis from a place of positivity. One of the reasons is that all this media bombardment and so on about the issue is creating a lot of insecurity amongst people. And the conference was organized by the International Positive Psychology Association. So it's evident that more work needs to be done in that area, and not enough is addressed. And maybe the way the messaging that is done around climate change needs to be revisited in a way that ensures that, yes, it achieves what is the desired outcome, but also takes into account those issues. Okay, so let's look into our other questions. What are the dimensions of climate migrations that may impact global health and security? This is a tough question. We can move on to the next if no one has an answer. And we do not have to have an answer for every question. This is obvious. What are the most cost-effective strategies to tackle climate change, particularly those affected by public health? I don't know if Reem, from your research on Amman, were there interventions that were cost effective in your from your perspective and could be shared here, or we still need to do more?
Actually, we still need to do more, and we still need to integrate health within systems and urban systems. So I don't have like specific answer to that, but we do need integrated planning management for public health and public health issues, precisely.
Excellent. So I think these are Dr. Hannah, you'd like to say something?
Sorry, very briefly, I just wanted to add that there is a very large breadth of research at this point that shows that investing in adaptation is much more cost effective than investing in the impacts of climate change on health in the absence of adaptation. And so really, again, the emphasis needs to be on proactive measures to build resilience amongst communities already impacted by climate change, as opposed to waiting for them to basically, waiting for them to experience the health impacts that come from not being able to respond to climate-related hazards.
And this fits very well with the results of the research Dr. Lucy and I did, which, if you can see, I'll send the link to within the chat box, which says that not enough investments are made in adaptation in the region. So this is one area that needs much more intervention. Reem.
So just one thing crossed my mind when Dr. Hannah mentioned that. So adaptation, climate adaptation, and health prevention or preventive prevention in health sector are also aligned. So when we talk about climate adaptation, we talk about prevention in health sector. That's it.
Excellent. I think at this point, I'll move on to the closing remarks. And I would like to send a very big thank you to all our distinguished panelists for their insightful contributions, and to our audience for your engagement and thoughtful questions. And sorry if there were questions we could not answer. Today's discussion has emphasized the urgency of addressing the interconnected challenges of climate change, migration, and public health, particularly in the Eastern Mediterranean region. We've explored how climate-induced migration is shaping health vulnerabilities, the critical gaps in research and policy, and the ways in which the One Health approach can provide a comprehensive framework for resilience. From urban planning to public health systems, and from migration policies to cross-border collaboration, it's clear that innovative multidisciplinary efforts are essential. As we close, let us reflect on the key takeaways. The need for actionable solutions rooted in robust research and evidence. Moving forward, MFNET and RTI International are committed to moving ahead with this dialogue and building upon what has been discussed today. In the coming weeks, we will share a report capturing today's insights, aiming to promote focused research to guide policies and interventions that enhance resilience across the region. Thank you again for being part of this conversation. Let's continue to work together to build a healthier, more resilient future for the Eastern Mediterranean region. Have a wonderful evening or rest of the day, wherever you are in the world. Peace be upon you, everyone.
Thank you.